Welcome to Guideline Central. My name is Dr. Tabitha Michaud, and today we're going to be talking about hypoglycemia. More specifically, how we can mitigate and manage hypoglycemia in our diabetic patients. So today we'll be talking about the Endocrine Society's new guidelines titled The Management of Individuals with Diabetes at High Risk for Hypoglycemia, an Endocrine Society clinical practice guideline. This was originally published in December of 2022 in the Journal of Clinical Endocrinology and Metabolism. The purpose of this guideline is to provide updates in the field of diabetes-related hypoglycemia, including for type 1 and type 2 patients, adult and pediatric patients, as well as inpatient and outpatient options. And this guideline is targeted for healthcare providers who are managing and treating patients with diabetes who are at high risk for hypoglycemia. Now, this guideline is actually an update to the Endocrine Society's 2009 clinical practice guidelines titled The Evaluation and Management of Adult Hypoglycemic Disorders. But in this 2022 update, the Endocrine Society specifically focuses on treatment for individuals with diabetes at high risk for hypoglycemia, and it also emphasizes advancements in diabetic technology, as well as insulin therapy for glycemic control and patient education. A couple of things to mention before we get into the recommendations. For this guideline, the Endocrine Society has used the GRADE approach for their methodology. That means that each recommendation will be assigned both a strength of recommendation as well as a certainty of evidence grading. There's also a couple of abbreviations we want to go over before we get into the recommendations. The first is CGM, which is continuous glucose monitoring, ADIP, algorithm-driven insulin pump, MDI, for multiple daily injections, and then SMBG, or self-monitoring of blood glucose. Now, if you're looking for more information about these abbreviations and their definitions, you can find it all expanded upon in the full text guidelines, which there's a link to on our website at guidelinescentral.com. But now, let's get into the guidelines. So in our Guideline Central quick reference format, we're going to go over the Endocrine Society recommendations, as well as highlight some of the implementation remarks for managing diabetes-related hypoglycemia. Starting off with our first recommendation, which was given a strong recommendation with a low certainty of evidence. For this recommendation, the Endocrine Society recommends for the use of CGM rather than self-monitoring of blood glucose by fingerstick for patients with type 1 diabetes receiving multiple daily injections. For our second recommendation, the Endocrine Society gives a conditional recommendation with low certainty of evidence. Here, they suggest for the use of real-time CGM and ADIP rather than MDIs with self-monitoring of blood glucose 3 or more times daily for adults and children with type 1 diabetes. Now, for both this recommendation and the one before, the Endocrine Society does include an implementation remark emphasizing the importance of patient education, making sure that they know how to use, interpret, and troubleshoot their CGM devices. It's also important patients keep on hand supplies for self-monitoring of blood glucose by fingerstick. That way, they're able to validate and confirm the results on their CGM device. For our next recommendation, the Endocrine Society suggests for the use of real-time CGM rather than no CGM for outpatients with type 2 diabetes who are on insulin and/or sulfonylureas and are at high risk for hypoglycemia. This recommendation was given a conditional recommendation with very low certainty of evidence. For our next recommendation, the Endocrine Society gave a conditional recommendation with very low certainty of evidence, where they suggest for the initiation of CGM in the inpatient setting for select inpatients who are at high risk for hypoglycemia. For our fifth recommendation, the Endocrine Society gave a conditional recommendation with very low certainty of evidence, and here they suggest for the continuation of personal CGM in the inpatient setting with or without ADIP therapy, rather than discontinuation. The sixth recommendation from the Endocrine Society is a strong recommendation with very low certainty of evidence, and that's for the recommendation of inpatient glycemic surveillance and management programs leveraging EHR data should be used for inpatients at risk for hypoglycemia. For our next recommendation, the Endocrine Society suggests long-acting insulin analogs be used rather than human NPH insulin for adult and pediatric outpatients on basal insulin therapy who are at high risk for hypoglycemia. This was given a conditional recommendation with very low certainty of evidence. Our eighth recommendation from the Endocrine Society suggests that rapid-acting insulin analogs be used rather than regular or short-acting human insulins for adult and pediatric patients on basal bolus insulin therapy who are at high risk for hypoglycemia. This recommendation was given a conditional recommendation with very low certainty of evidence. The 9th recommendation from the Endocrine Society recommends a structured program of patient education over unstructured advice be used for adult and pediatric outpatients with type 1 or type 2 diabetes receiving insulin therapy. This was given a strong recommendation with low certainty of evidence. I wanted to mention, for this recommendation, in both the pocket guide and the full text guidelines, you can find a table associated with the recommendation that includes the elements of a structured diabetes program for patients who are at risk for hypoglycemia. And our last recommendation, recommendation number 10 from the Endocrine Society, this recommends the use of glucagon preparations that do not have to be reconstituted over glucagon preparations that do need to be reconstituted should be used for outpatients with severe hypoglycemia. This recommendation was given a strong recommendation with a very low certainty of evidence, but there is a table included in the pocket guide and the full text guidelines that shows the available glucagon preparations in case you want more information about that. And with that, we wrap up the last of the recommendations from the Endocrine Society on the management of individuals with diabetes at high risk for hypoglycemia. Now, what we went over today was, of course, just the bird's eye view approach in our Guideline Central quick reference format. If you're looking for more information about the recommendations, including implementation remarks, tables, as well as definitions, you can find that in the full text guideline as well as the pocket guide, both available on our website at guidelinecentral.com. While you're there, make sure to check out our library of quick reference guideline content, as well as hundreds of available guidelines from over 45 different medical societies. Thank you guys for joining me today to talk about the Endocrine Society's hypoglycemia recommendations, and I'll see you guys on the next guideline.